Hello, it's Dr. Olar here. I just want to give an update, also to encourage you as far as staying home, sit around and washing our hands and passing the time. I just came across some articles. Most recently, I came across an article that took place the 12th of May, and just read the title of it. It states here that the antibody testing reveals that the COVID-19 antibodies were in Ohio since January. So that came across. And as far as another article, this took place early part of March. Again, this was with the FDA crackdown on fraudulent prevention and treatment claims with the virus itself. But what are we going to do? That's the main question. Whether you're at home, out and about, at work, we're given so many different guidelines of what to do. And the main thing is, what I'm trying to do is just encourage you and think about things that you can do to help your immunity. And I'm just going to share some of the articles I came across. Again, staying at home, washing your hands, and just waiting. It may not be enough for you. Obviously, we're getting ready to be more active, if not this past week, this next week, this next month, this summer, in the fall. I just want to share some articles with you. To begin with, I want to share an article about elderberries. Just to read here, it states that the elderberry inhibits the early stages of a viral infection, blocking key viral proteins responsible for both the viral attachment and entry to host cells. So that's important. However, this is extremely important. You don't want to continue. It states here not to take the elderberry because it increases your cytokines. So with a viral infection with COVID-19, elderberry would hurt you if you continue to take it when you're sick, but it can help prevent you from becoming sick based on this article here. Again, I'm just giving you some ideas to think about. Another one, article that was reviewed medically by Dr. Sullivan. It says here, oregano oil for cold and flu doesn't work. Another part of the property of oregano oil, it states here that the herbal supplement in oregano oil for the antiviral, anti-inflammatory, and antioxidant properties, and it contains carbapenem, thymol, and terpene. Excuse me. So as far as with taking certain supplements, things that you can what you can do to help yourself. Another article, this was done recently, last fall, and that came across in January 2020 here. Again, it was submitted in October 2019. Antiviral properties of vitamin C. There's many studies, but they took research studying sepsis, septic shock, and they had a protocol using vitamin C for those that went into sepsis. Again, with your blood and how your body can respond, they used what they would call the HAT therapy, and that stands for hydrocortisone ascorbic acid, that's vitamin C, and thiamine. So they use that to take care of those with septic shock. As far as the properties of vitamin C, they're concentrated in white blood cells, in leukocytes, lymphocytes, and macrophages, reaching high concentration in these cells. As far as with using vitamin C, other supplements, again, there's lots of research out there. I'm not advocating you that this is going to cure you or help you avoid completely any infection or bacterial infection, but just giving you ideas, things to think about. The next one, I would say this is more of a dietal therapy, and as far as like being in ketosis, you have to be careful. I'm not saying to try this or not to try it. I'm just simply reading the article title here. Ketogenic diet helps tame flu virus. Okay, this was written November 15th, 2019, from Yale University. And just read a snippet from the article here from Science Daily. They showed that mice fed a ketogenic diet and infected with influenza virus had a higher survival rate than mice on a high-carb normal diet. Specifically, the researchers found that the ketogenic diet triggered the release of gamma delta T cells, okay, that produce mucus in the cell linings of the lung, okay, while the high carbohydrate diet did not. Okay, again, just giving you ideas, things to think about. With ketogenic diet, that was a hot topic. As far as like with exercise, making sure in your ketosis, there's many different steps to follow, and not everyone can do this. I'm just giving you ideas to think about that you might not come across reading the news and seeing everything else that's out there. I'm just trying to encourage you, give you some type of positive lift here, things that you can do. Another article that I came across recently in April 24th, 2020, it was published here. Vitamin D in the coronavirus pandemic, should you take it? As far as with vitamin D, they had a placebo group, and then those that were given vitamin D, they stated that taking vitamin D from the placebo group did not really show any significant increase or decrease. But as far as like with vitamin D, you can see as far as with the diet that is known to participate in certain types of white blood cells which fight infections. Again, just another article that you can take a look at. Looking at the coronavirus, many people that have issues with the virus, there's research out there that their serum blood samples, those that have a higher serum level, a thicker blood, the survival rate has been measured with that. So as far as like with sharing some dietal aspects of what I'm sharing now, I included the ketogenic diet, vitamin D, oregano oil. A lot of times we don't get enough oils in our diet, but we have to be careful as far as the properties. If you're on blood thinning medication already, or you have issues with clotting, so you have to be careful in that regard. But as far as like just encouraging you, looking at some articles, I know there's a lot of information out there. I just want to point some things out that that can help. I just want to lift you guys up. There's a lot going on. I've just been counting the days down to the 1st of June. So right here in the middle of May, 2 months after it was a declared pandemic, there's not a lot of guidance what we can do naturally to help our body, help our immunity stay strong. So again, I just want to encourage you guys, stay positive. We're all in this together, and being able to stay fit, eat healthy. If you can, get most of your nutrition from your foods that you eat. So anyways, I just want to encourage you guys. All right, take care. Thank you.